Most of us think about an infection when itching becomes unbearable. But do you know that your body has started giving you warning signs before that itching? Yes. And if you ignore these early signs, you are not just going to be dealing with discomfort only. You are setting up yourself for an infection that will keep coming back months after months. This video is for you. Please don't scroll, because I'll be breaking down 5 specific symptoms of vaginal infection and the exact nursing steps to stop them in their track before it becomes chronic. But note, you need to pay close attention to symptom number 3, because it is the one that most women mistake for a normal part of their cycle, not knowing that it is the biggest clue that something is wrong. Okay? So now let's look at the first sign. Symptom number 1. Change in texture, not just in color. Most people look at the color of their discharge, not the texture. But the texture is the one that will tell you the bigger story. So if you touch your discharge and it's feeling like cottage cheese or watery thin consistency, that means your body is sounding an alarm that something is wrong. That is unusual of your cycle. It is the first sign of yeast or bacterial infection. Sign number 2. The lingering odor. So let's be real. Everybody has a scent. Yes, everybody has a scent. But if it has a fishy or strong metallic smell that gets worse even after your period or after intimacy, after sex, that is a sign of bacterial vaginosis. And some people will try to wash away the smell with scented soap. Please, don't. It actually makes it worse. It makes the smell worse. You need to treat the source. Sign number 3. Persistent redness and swelling. So if you can remember, I told you guys to not ignore this sign, especially this sign. Sometimes there is no itch. There's no itch at all. Just a feeling of heaviness and visible redness and swelling. And many women will see this sign. They will ignore it, saying that, maybe it's just the irritation from my clothes, jare. No. It can be a sign of a deep-seated inflammation that needs professional attention immediately before it spreads. Okay? Sign number 4. Burning during urination. So anytime you go to the toilet to pee or to urinate and you notice a burning sensation, you notice a peppery sensation anytime you urinate, you might be thinking that it is UTI, that's urinary tract infection. You need to observe. If that burning is on the outside skin rather than the inside, if it is on the outside skin, that is a sign of vaginal infection that is irritating the surrounding tissues. Point number 5, which is the final point. Pain during intimacy. Pain during sex is never normal. So if it feels like sandpaper or is feeling like a deep ache, that means your vaginal lining is likely to be inflamed. That is the way your body is telling you that, hold up, it needs time to heal. So please allow your body to heal up. Now let's move on to how to stop it forever. How to stop vaginal infection forever. Number 1, follow the cotton rules. So if you want to reduce the risk of having vaginal infection, you need to switch to 100% cotton underwear. Cotton allows air to circulate and keeps the area dry. Avoid synthetic fabrics because they trap heat and moisture, and that is the perfect environment for bacteria to grow. 2, the sugar connection. High sugar intake feed on yeast. So if you're having infection every month, you need to check your diet. Avoid sugar intake. 3, probiotics. You need to replenish the good bacteria. I talked about good bacteria in my previous video. So if you have not watched it, please go back and watch it. You need to replenish the good bacteria. So you need to buy or use probiotic that is specifically for vaginal health to maintain the vaginal pH balance. So ignoring these signs will only make the road of your recovery longer. So if you have experienced or you are experiencing any of these signs, please don't wait to speak to your healthcare professional. If you find this video helpful, please click on that subscribe button, like, comment, and share. I will see you guys in my next video. Bye.